How does HIV test strip work? Hi friends, welcome back to Mark Medicals. You guys have asked me to explain how rapid HIV testing kits work. Here is the best answer for you. Please watch till the end to learn more about the test window period and why you could be HIV negative but test positive. HIV test strips, also known as rapid HIV tests or lateral flow immunoassays, are simple-to-use diagnostic tools designed to detect the presence of HIV antibodies in a person's blood, saliva, or urine. These tests provide quick results, usually within 15-30 minutes, making them valuable for both clinical and home use settings. Here's an overview of how HIV test strips work. Principle of detection. HIV test strips rely on the principle of antigen-antibody reactions. When a person is infected with HIV, their immune system produces specific antibodies to fight the virus. These antibodies are the primary targets of most rapid HIV tests. Components of the test strip. 1. Sample pad. This is where the specimen, blood, saliva, or urine, is applied. 2. Conjugate pad. This contains HIV antigens, proteins from the virus, labeled with a colored particle, usually colloidal gold. 3. Nitrocellulose membrane. This is the main reaction zone with test and control lines. 4. Absorbent pad. This draws the sample through the strip. How to use the test strip step-by-step process. 1. Sample application. Here, the user applies a small amount of the specimen to the sample pad. 2. Sample migration. In this compartment, the liquid sample moves along the strip by capillary action. 3. Conjugate reaction. As the sample reaches the conjugate pad, any HIV antibodies present in the sample bind to the labeled HIV antigens. 4. Test line reaction. The sample continues to migrate to the test line, which contains immobilized HIV antigens. If HIV antibodies are present in the sample, they will bind to these antigens, forming a visible colored line. 5. Control line. Reaction. The sample then reaches the control line, which contains antibodies that bind to the labeled antigens regardless of the presence of HIV antibodies. This line appears in all valid tests, confirming that the test has worked properly. 6. Result. Interpretation. The presence or absence of colored lines at the test and control regions determines the result. Your results can be interpreted as follows. Negative. You are negative if only the control line appears. Positive. You are positive only if both test and control lines appear. Invalid. Your test is invalid if no control line appears, regardless of test line presence. Sensitivity and specificity. Modern HIV test strips are highly accurate, with sensitivity and specificity often exceeding 99%. However, they have two limitations, such as 1. Window period. There's a period, usually 6 weeks, after infection when antibodies may not be detectable, potentially leading to false negative results. 2. Cross-reactivity. In rare cases, other conditions might cause false positive results. For instance, if you have an allergy or any other serious autoimmune disease. Types of HIV test strips. 1. First-generation tests. These detect only HIV IgG antibodies. 2. Second-generation tests. These detect both IgG and IgM antibodies, reducing the window period. 3. Third-generation tests use sandwich techniques for higher sensitivity. 4. Fourth-generation tests can detect both HIV antibodies and the P24 antigen, further reducing the window period. Advantages of using HIV testing strips. Rapid results. 15-30 minutes. They are easy to use, requiring minimal training. They are suitable for point-of-care and home testing, and there is no specialized equipment is needed. On the other hand, the limitations to using HIV rapid testing strip are they cannot detect very recent infections within the window period. Positive results require confirmation with more sensitive lab-based tests. They may not differentiate between HIV-1 and HIV-2, and their storage conditions can affect test performance. Quality control. Manufacturers implement strict quality control measures to ensure test reliability. Each test includes a built-in control or the control line to verify proper test function. Regulatory oversight. HIV test strips are regulated as medical devices. In the United States, the FDA oversees their approval and quality standards. Similar regulatory bodies exist in other countries to ensure test accuracy and reliability. In conclusion, HIV test strips represent a significant advancement in HIV diagnostics, offering a quick, accessible, and relatively accurate method for HIV screening. While they have revolutionized early detection and expanded testing accessibility, it's crucial to understand their limitations and the need for confirmatory testing of positive results. As technology advances, these tests continue to improve in sensitivity and specificity, playing a vital role in global HIV prevention and treatment efforts.